So what I'm going to do is just work on myself by laying down and just doing some basic mobility, working on my own low back pain. So I'm just moving my hips and leg around to see what feels good. So I just prop myself in a way that allows me to relax. I feel this long line of tension down my femur, down through the hip, into that spot in my low back. So I'm just going to hang out there for a second, breathe. I'm going to switch sides just to see what it feels like. It doesn't have quite the same intensity. I still feel some tightness on this left side. I'm going to balance it out, but it doesn't feel like the right side does. And again, I prop myself. What feels good? What kind of movement? What if I twist to the other side? And open my arm to get a stretch through the chest as well. Go back to center. I'm going to allow both hips now to fall open. And I want to see if my adductors are muscles on the inside. They attach at the pubic symphysis or on the pubic bone and go out onto the hamstring. And then, let's see, how does this feel? That actually starts to feel much better. And long term, the reason that I wanted to show you what I was doing to deal with my own discomfort is this is very much how my bodywork and yoga practice has evolved, is being able to work on bodies in much the same way that I'm showing you. This is a sort of home practice that I have, working on myself, doing my own self-care. This feels much better right there. It feels like we started broad and then I've gone down to specific, like I've isolated the QL. I thought maybe that would have been the issue. But I've been able to work through the hip, work through some of the structures that might be a little bit off, a little tight, maybe causing that. To stretch, move and breathe. You're always working within your own range of motion and you're always working with your body. Each day is going to be different. I teach yoga. I teach my students how to reboot their clients. I'm a body worker. I could have addressed this by saying, well, you're not supposed to hurt and being down on myself, but you just accept that you have a little bit of back pain and learn how to slowly work on it. Just to balance out, just going to see how the left is. Still tight. I mean, I feel some tension here, but it doesn't have the sharpness that the right side did. Just to balance out. I feel a little more tightness actually in my hamstring on this right side. So, go slow, breathe, mobilize, and stretch within your own range of motion. You're not making anything hurt, but it can feel intense at times. Play with that and see what gives you better results. If you have low back pain, you can use exactly what I was doing and following along.